If we look at cancer patients, the first impression that will come to our mind is empathy towards the person. This feeling is surely will become stronger as the person is one of our close family member. We could see their suffering day by day as the stage of the cancer develop from its early stage to its final stage. So the first method that will come to our mind to treat this cancer with less painful approach compared to the surgery will be chemotherapy. However, do you know that there is another method that poses less dangerous approach yet same efficient with compared to the chemotherapy method to treat this cancer? Yes, the name is brachytherapy treatment. Today, I would like to talk about it through my final year project, which is Monte Carlo Dosimetric Characterization of a high dose red cobalt-63 brachytherapy source. So, what is brachytherapy? Brachytherapy method is done simply by placing the radioactive source close to the cell that we wanted to be treated. This means that there is stainless steel needle-like structure which is called probe will be penetrate towards the cancer cell. But the needle is a little bit bigger with 5 mm diameter. The radioactive source with 0.6 mm diameter is situated inside the probe. Don't worry, the patient will not feel any pain as the anesthesia will be given when the slightly bigger needle punctured toward the flesh. So, what about Monte Carlo? What is Monte Carlo? Monte Carlo simulation is the name of simulation code used in my study to build the picture or geometry of the equipment as well as to calculate the data. A Monte Carlo neutron particle 5 or MCNPX is one of Monte Carlo's code that track the past almost all type of radiation interaction as well as calculating its characteristics along the way. Since brachytherapy treatment use gamma radiation from its source, so this method should be applicable to study it. This method of MCNPX had never been used before to study the brachytherapy. Hence, before continue to study the brachytherapy using this method, it needed to be ensured that the result is valid, right? Okay, how to validate it? I give you an example. After sitting an examination and you want to know if your answer is right or wrong, what will you do? Surely you will go to your most intelligent friend to seek for an answer, right? And then compare with your answer. Because you know that your friend always get full mark for that particular subject. So it is the same for this method actually. A formalism introduced by task group 43 is used in comparison with the most intelligent friend who its result for that formalism is already validated. His name is Granero. This is the first objective for my FYP, which is to validate the Monte Carlo code used, which is MCNPX5 for simulating the brachytherapy source by using task group 43 formalism. The setup of the simulation is as shown. The cobalt-60 is situated in the center of the 125 cm radius sphere. The dose distribution is recorded for few positions inside the sphere. The results is then used to find the radial dose function, which is one of the TG43 formalism. Then they were compared with our intelligent friend, which is Granero, as shown in this graph. Both results presents a good agreement with only 0.73% final standard deviation differences. From this simulation also, I also recorded another TG43 formalism, which is dose rate constant. We also can see that there are only a slightly differences between this method results with another method that has been valid, which is only 0.85% differences. The only explanation for this is this method is valid to be used as it produces a good accuracy in its calculation. Moving on to the second part of my study, which its aim is to calculate the depth dose for PMMA trigger phantom, which is used in the real brachytherapy treatment planning in University Malaya Medical Center. The property of dose distribution is analyzed for the effect of metallic shielding towards the needle-like probe. This work has successfully shown that the presence of the shield does not affect very much in terms of the dose delivered compared to the source without shield in just 0.6% differences. This proves that most of the dose will be delivered to the tumor cells. It is important for the precise height dose is successfully delivered to increase the efficiency of this treatment. Hence, just like we have options to pick various flavors of ice cream that we wanted to eat, cancer patients also can have options to pick what method they wanted to be treated with. Hashtag Cancer Patients Life Matter.